You wake up in the morning expecting to feel rested, but instead, the first thing you notice is that your mouth feels completely dry. Your tongue feels rough, your lips may feel cracked, and you immediately reach for a glass of water. For many older adults, this has quietly become part of the morning routine. You drink some water, brush your teeth, and move on with your day without thinking much about it. But waking up with a dry mouth every morning is not always something to ignore. In some cases, it can be an early signal that the body is under stress or that an underlying health issue may be developing. Today, you'll learn about 5 serious conditions that can be linked to frequent morning dry mouth, the warning signs that often appear with them, and simple steps that may help protect your health. But before we talk about those conditions, we need to look at something most people rarely think about: saliva. Because this simple fluid quietly protects far more of your health than most people realize. Most people think saliva is just moisture in the mouth, but it actually plays a much bigger role in protecting your health. In fact, healthy adults produce nearly a liter of saliva each day. Saliva helps begin digestion the moment food enters your mouth. It washes away food particles and harmful bacteria that could damage your teeth and gums. It also helps keep the delicate tissues inside your mouth healthy and protected. Even while you sleep, your salivary glands continue producing saliva to maintain this balance. But when saliva production drops too low during the night, that balance begins to change. Bacteria can multiply faster, the tissues inside the mouth become irritated, and you wake up with that familiar dry, sticky feeling. When this happens occasionally, it may not mean much. But when it becomes a regular morning symptom, it can sometimes point to a deeper problem, and one of the most common reasons begins with how you breathe while you sleep. Condition number 1, sleep apnea. One of the most common reasons people wake up with a dry mouth every morning is a condition called sleep apnea. Millions of older adults experience sleep apnea, and many do not realize they have it. During normal sleep, breathing usually happens through the nose. The nasal passages help warm and humidify the air before it reaches the lungs. But when the airway becomes partially blocked during sleep, the body often switches to mouth breathing to keep oxygen flowing. And that's where the dryness begins. When the mouth stays open for long periods during the night, the steady flow of air dries the tongue, gums, and throat. By morning, saliva levels may drop so low that the mouth feels sticky, uncomfortable, and extremely thirsty. Sleep apnea can also cause other symptoms that many people overlook. These may include loud snoring, choking, or gasping during sleep, morning headaches, and feeling unusually tired even after spending enough hours in bed. Over time, untreated sleep apnea can affect more than sleep quality. It has been linked to higher blood pressure, heart disease, and repeated drops in oxygen levels during the night. If dry mouth happens together with snoring or daytime fatigue, it may be worth discussing this with a healthcare professional. Tests such as a sleep study can identify the condition, and treatments like CPAP machines or oral devices can greatly improve nighttime breathing. But breathing during sleep is not the only reason morning dry mouth can appear. Another common cause begins with how the body handles blood sugar. Condition number 2, type 2 diabetes. Another condition that can quietly cause persistent dry mouth is type 2 diabetes. This connection often surprises people because the dryness does not begin in the mouth itself. Instead, it starts with how the body handles blood sugar. When blood sugar levels rise too high, the body tries to remove the excess glucose through urine. This process pulls additional fluids out of the body. Over time, that loss of fluid can lead to dehydration, which reduces the amount of saliva the salivary glands are able to produce. The result can be a mouth that feels dry, sticky, or unusually thirsty when you wake up. For many people, this dryness appears alongside other symptoms that may seem unrelated at first. Some people notice increased thirst, blurred vision, unusual fatigue, or tingling sensations in the hands and feet. These signs can develop gradually, which is why they are sometimes overlooked. The reason this matters is that untreated diabetes can slowly affect many parts of the body. Over time, high blood sugar can damage nerves, kidneys, and blood vessels, and it may also affect vision. That's why early detection is so important. Simple blood tests such as fasting blood sugar or an HbA1c test can help determine whether blood sugar levels are within a healthy range. Managing blood sugar through balanced meals, regular physical activity, and proper medical guidance can greatly reduce the risk of complications. But dry mouth can also appear even when blood sugar levels are normal. In many cases, the cause may actually be something found in a person's daily medications. Condition number 3, medication side effects. Another very common reason older adults wake up with a dry mouth is medication side effects. Many prescription and over-the-counter medicines can reduce saliva production. This happens because some medications affect the nerves and glands responsible for producing saliva. Drugs used to treat high blood pressure, allergies, depression, anxiety, and certain types of pain are among the most common examples. When these medications influence the salivary glands, the mouth may produce less moisture, especially during the night. For older adults, this effect can become stronger for another reason. Many people take several medications at the same time, a situation doctors often call polypharmacy. When multiple medications each have a drying effect, the combined result can significantly reduce saliva levels. Over time, this dryness can do more than cause discomfort. Saliva plays an important role in protecting teeth and gums. When saliva is reduced for long periods, the mouth becomes more vulnerable to cavities, gum disease, and oral infections. Some people may also notice difficulty swallowing or a burning sensation in the mouth. If you suspect medications may be contributing to dry mouth, it's important not to stop them on your own. Instead, discuss the issue with your doctor. In many cases, doctors can adjust dosages, suggest alternative medications, or recommend saliva-stimulating products that help keep the mouth moist. But medications are not the only possible explanation. Sometimes, the immune system itself may begin affecting the glands that produce saliva. Before we move on, please take a moment to like this video and subscribe to Senior Revival, where simple changes for seniors can lead to a powerful, healthy comeback. Condition number 4, autoimmune disorders. Another condition that can quietly lead to persistent dry mouth involves the immune system itself. Normally, the immune system protects the body by attacking viruses, bacteria, and other harmful invaders. But in certain autoimmune disorders, the immune system mistakenly begins attacking healthy tissues. One of the areas that can be affected is the salivary glands, the glands responsible for producing saliva. A well-known example of this is a condition called Sjogren's syndrome. In this disorder, the immune system targets the glands that produce moisture in the body. As a result, saliva production may drop significantly, leaving the mouth feeling dry for long periods. People with this condition often experience more than just dry mouth. Many also notice dry or irritated eyes, joint discomfort, fatigue, or difficulty swallowing dry foods. Because these symptoms can develop slowly, they are sometimes mistaken for normal signs of aging. This is one reason autoimmune conditions may go undiagnosed for years. Identifying the problem usually requires medical evaluation and specific laboratory tests that look for immune system activity. While autoimmune disorders cannot always be completely cured, treatments are available that can help control symptoms and protect the affected glands. Managing the condition early can make a significant difference in comfort and long-term health. But autoimmune conditions are not the only reason dry mouth appears. Condition number 5, chronic dehydration. Sometimes the reason for persistent dry mouth is not a complex disease, but something surprisingly common, chronic dehydration. As people get older, the body's natural thirst signals often become weaker. This means many older adults simply don't feel thirsty as often as they once did, even when the body actually needs more fluids. Certain medications can make this even more noticeable. Drugs such as diuretics, often prescribed for blood pressure or heart conditions, increase the amount of fluid the body releases through urine. Over time, this can gradually lower the body's overall hydration levels. Lifestyle habits can also play a role. Drinking large amounts of coffee, tea, or alcohol, especially later in the day, can contribute to fluid loss. Dry indoor air from heating systems or air conditioners may also dry the mouth and throat overnight. When the body becomes dehydrated, saliva production often decreases. Without enough saliva, the mouth may feel sticky and uncomfortable when you wake up. Other signs of dehydration may appear as well. Some people notice dark-colored urine, fatigue, dizziness, or unusually dry skin. Fortunately, this is one of the easier causes to address. Drinking fluids regularly throughout the day, limiting dehydrating beverages, and maintaining a balanced diet can help restore the body's natural fluid balance. But dry mouth is not just uncomfortable. If it continues for long periods, it may lead to other health problems that many people never expect. Many people think dry mouth is simply an uncomfortable nuisance, but when it happens regularly, it can lead to problems that extend far beyond the mouth itself. Saliva is one of the body's quiet protectors. It helps maintain balance inside the mouth and keeps delicate tissues healthy. When saliva levels stay too low for long periods, that protection begins to weaken. As a result, cavities and gum disease can develop more easily, and the tissues inside the mouth can become irritated or inflamed. For many people, the first real warning appears while eating. Dry foods may suddenly feel difficult to chew or swallow, and meals that once felt normal may become uncomfortable. Over time, this can lead to nutritional problems, especially for older adults whose appetite may already be reduced. In some cases, bacteria from the mouth may even reach the respiratory system, increasing the risk of respiratory infections. The important thing to remember is this: dry mouth is often a signal, not just a symptom. And once you recognize that signal, there are several practical steps that can help restore moisture and support your body's natural balance. Let's look at some simple, practical solutions that can help improve dry mouth. First, focus on consistent hydration throughout the day. Many people try to drink a large amount of water right before bed, but the body absorbs fluids better when they are spread out during the day. Taking small drinks of water throughout the day helps maintain hydration and supports saliva production. One helpful rule is simple: don't wait until you feel thirsty. As we age, thirst signals often become weaker. Second, include more water-rich foods in your meals. Foods such as cucumbers, melons, oranges, and leafy greens naturally provide fluids while also delivering vitamins and minerals that support overall health. These foods can quietly contribute to hydration without feeling like you are constantly drinking water. Third, reduce beverages that can increase dryness. Drinks containing caffeine or alcohol may promote fluid loss and make nighttime dryness more noticeable, especially when consumed in the evening. Fourth, improve the air quality in your bedroom. Dry indoor air from heating or air conditioning systems can make the mouth and throat drier during sleep. Using a humidifier at night can help add moisture to the air and make breathing more comfortable. Fifth, support healthy saliva production during the day. Simple actions such as chewing sugar-free gum or eating crunchy fruits and vegetables can stimulate the salivary glands and help keep the mouth moist. Sixth, maintain good oral hygiene. Brushing, flossing, and regular dental visits help protect your teeth and gums, which is especially important when saliva levels are low. Many people notice improvement within a few days of improving hydration and daily habits. But sometimes, persistent dry mouth may signal that something deeper needs medical attention. Occasional dry mouth may not be serious, but when it happens frequently, especially every morning, it may be worth paying closer attention. Some warning signs should never be ignored. If dry mouth appears together with constant fatigue, difficulty swallowing, frequent infections, or sudden unexplained weight loss, it may signal an underlying health issue that needs medical attention. Another sign is when dryness begins to affect everyday life. If eating becomes uncomfortable, swallowing feels difficult, or dental problems start appearing more often, it's a good idea to discuss it with a healthcare professional. A doctor may review your medications, check your hydration levels, or recommend simple tests to understand what may be causing the dryness. The important message is simple: your body often sends early signals before bigger problems appear. Dry mouth might seem like a small symptom, but sometimes it can be the body's way of asking for attention. Paying attention to those signals and acting early can help protect your long-term health. And if you know someone who often complains about waking up with a dry mouth, sharing this information could help them recognize a problem sooner. We're building a community here to support your strong, healthy comeback. If this helped you, I'd truly appreciate a like and if you subscribe. Also share it with someone you love. And join me in the next video for another simple step toward better health.